America's healthcare crisis centers around the tens of millions of people who are uninsured, while just a trickle of people supposedly so far have signed up for the Obamacare through the exchanges. The floodgates are wide open for the Medicaid recipients, and that could potentially pose a significant problem for the entire program. Tom Foreman is here to explain what's going on here, Tom.
Wolf, this is early in the process. That's really important to bear in mind. But the goal of the Obamacare plan from the beginning has been to start to reduce this number right here, 47 million uninsured legal adults in this country, residents. They don't have health insurance. In theory, this goal is reached by getting most of them to buy, in a 3-year term, private insurance through the healthcare exchanges. About 22 million insured through the exchanges if everything goes right, and by getting about 12 million covered through Medicaid, which is, of course, the healthcare program for poor people. They're the targets 3 years from now. 22 million insured through exchanges, 12 million covered through Medicaid. 15 states, and we're going to show you here the map, have decided to opt out of the Medicaid buy-in because they're arguing it will cost taxpayers too much money over time to pay for that coverage for those people. But what's happening in some of the other states that are participating is raising eyebrows about this whole process. And let's talk about that, because some people are signing up for this free health insurance through Medicaid much faster than people are buying insurance through the exchanges. In Washington, for example, 35,000 people have enrolled for coverage, but of that number, 87% of them are coming in through Medicaid. In Kentucky over here, 26,000 people have signed up, new enrollees. 82% of those have come in through Medicaid. And in New York, 37,000 people have signed up so far, 64% through Medicaid. You can see the imbalance here, Wolf. They want much more robust numbers in terms of the other enrollment. And if that doesn't pick up through the exchanges, if that doesn't pick up steam, then we could see real economic challenges to Obamacare. Wolf?
Federal government releasing very little information on the enrollment numbers so far. We don't really know until, mid-November, Tom, when we'll get the real numbers?
Yeah, that's when we'll figure out whether or not this will continue. And in all truth, it's unlikely that this trend right now is going to continue at this rate. And here are 3 caveats as to why. Number one, it is early. Of course, if people really need a service and you make it free, they'll jump at the chance. Whereas when people have to pay for it, they will take a little bit longer to think about that. They'll probably delay that commitment. We've seen that in many different types of programs. Number two, it's early. The numbers we have so far are just too sketchy to really tell much about them. Doesn't matter if you're for this or against this. We just don't have a whole lot of data to work with yet. And number 3, it's early, Wolf. This is a very early part of this process. It's important to watch the numbers. If this keeps playing out over the next few months, then you have a real problem. That's why people are paying attention. But right now, it's just one of those artifacts of the system that people are looking at and saying, what if, Wolf?
Tom Foreman, thanks very much.